I'm Dr. Esther Pang. I'm a consultant at the Department of Respiratory and Critical Care Medicine. Today, I'm going to talk to you about asthma. This is on our agenda today. I'm going to talk to you about asthma and chronic, also called long-term airway inflammation, the dangers of salbutamol-only treatment, the importance of preventer inhaler, and common myths in asthma treatment. Firstly, I would like to share a little bit about asthma and its chronic, also called long-term airway inflammation. Asthma affects an estimated 339 million people worldwide. Asthma is a common chronic respiratory condition in Singapore. Around 5% of Singapore residents aged 18 to 69 years have asthma. Hospital admission for asthma in Singapore is higher than that of other high-income economies. The annual economic burden of asthma in Singapore is 2.09 billion Singapore dollars, with 79% due to productivity losses. This tells us that asthma is a common and serious condition in Singapore. Asthma cannot be cured, but you can control your asthma symptoms and prevent asthma attack with treatment prescribed by your doctor. Common asthma symptoms include wheezing, difficulty breathing, coughing, and chest tightness. In asthma, there is underlying chronic or what we call long-term airway inflammation. Your airways are narrowed due to swelling, presence of mucus, and tightened smooth muscle as seen in the diagram below. As a result of narrow airways, you experience common asthma symptoms as mentioned in the earlier slide. So, what are the dangers of salbutamol-only treatment? Salbutamol is also called Ventolin in Singapore and is commonly referred to as the blue inhaler in asthma. Salbutamol, the blue inhaler, has been used in asthma for many years. It provides rapid and short-term relief of your asthma symptoms by opening up the narrow airways. Many patients rely on it for their asthma condition. However, it does not treat the underlying airway inflammation in asthma. Using salbutamol, the blue inhaler alone, does not protect you from asthma attacks, even if your asthma is mild. So what are the dangers of salbutamol-only treatment? Salbutamol-only treatment puts you at higher risk of poorer lung function, asthma attacks, urgent asthma-related healthcare visit, for example, to the emergency department or polyclinic, and asthma-related death. Studies have shown that using 3 or more canisters of salbutamol, the blue inhaler, per year is associated with increased risk of asthma attack. Other studies also showed that using 1 or more canister of salbutamol, the blue inhaler, per month is associated with increased risk of asthma-related death. Salbutamol, the blue inhaler, should only be used as a reliever for your asthma symptoms with a separate regular preventer inhaler for long-term asthma control. This is a study conducted at 4 public hospitals in Singapore looking at patients admitted for severe life-threatening asthma attacks between 2011 to 2015. As you can see, almost 1 in 3 patients were only on salbutamol, the blue inhaler, as needed for their asthma condition, and yet they are admitted for severe life-threatening asthma attacks. So even if your asthma is mild and you only use salbutamol, the blue inhaler, as needed, there is a risk of severe life-threatening asthma attack. I would like to emphasize the importance of preventer inhalers. Preventer inhalers contain inhaled steroids. Inhaled steroids treat the underlying airway inflammation in asthma. This is proven to be the most effective treatment for asthma. Preventer inhalers reduce airway inflammation, control asthma symptoms, They also reduce the risk of lung function decline, reduce the risk of asthma attacks, and reduce the risk of asthma-related deaths. Poor adherence to your preventer inhaler increases your risk of an asthma attack. If you are prescribed a preventer inhaler, regular use is advised even when you are well. For some patients with mild asthma, your doctor may recommend treatment with a combination preventer and reliever inhaler as needed. If you experience side effects from your preventer inhaler, please consult your regular doctor before stopping the treatment. There are many different types of preventer inhalers in Singapore. Incorrect inhaler technique can also increase your risk of asthma attacks as the medications are not delivered directly to your airways. If you are unsure of how to use your inhaler, please consult your doctor, nurse, or pharmacist for support. Lastly, I would like to address some common myths in asthma treatment. Myth number 1, I only need the blue inhaler for my asthma. Fact, remember that the blue salbutamol inhaler only provides rapid and short-term relief of your asthma symptoms. It does not treat the underlying airway inflammation. Using the salbutamol blue inhaler alone does not protect you from asthma attacks, even if your asthma is mild. Salbutamol, the blue inhaler, should only be used as a reliever for your asthma symptoms, with a separate regular preventer inhaler for long-term asthma control. Myth number 2, steroid inhalers do not help with my asthma symptoms. Fact, steroid inhalers treat the chronic airway inflammation in asthma and improve your asthma symptoms in the long term. They can also reduce your risk of asthma attacks and asthma-related death. You are therefore advised to use your steroid inhalers even when you are well to prevent asthma symptoms. Myth number 3, steroid inhalers have side effects like oral steroid tablets. Fact, the steroid in your inhaler goes directly to your airways, so there is less side effects compared to oral steroid tablets. Common side effects of steroid inhalers include hoarse voice, sore throat, and oral thrush. This could be avoided or minimized by rinsing your mouth after use. Oral steroid tablet, on the other hand, is absorbed by many parts of your body and causes more serious side effects such as weight gain, high blood pressure, high blood sugar, increased chance of infection, and osteoporosis. The last myth, it does not matter how I use my preventer inhaler. Fact, the correct dose, timing, and inhaler technique are all important to ensure the direct delivery of medications to your airways so that it is effective and causes minimal or no side effects. I've come to the end of my asthma talk. I hope I've shared a little bit about asthma and its underlying chronic or long-term airway inflammation. I have highlighted the dangers of salbutamol, the blue inhaler only treatment, and I have emphasized the importance of preventer inhalers in long-term asthma control. And I hope I have addressed some of the common asthma myths that you may encounter. Lastly, if you have further questions regarding asthma and your asthma treatment, please consult your healthcare provider for further support. Thank you.